Hello and welcome back. This is Jen with Aging Advantage, and I am so glad that you are here for our final presentation, part 4 in our series of mood, memory, and meaning. If you joined us for all 4 parts, thank you for spending time with us. And if this is your first time watching any of this series, welcome. While today totally builds on what we've covered in the past 3 presentations, it also can totally stand on its own itself. So do not worry. If you have not seen the other ones, you can just go ahead and watch this one by itself, and it's really fun. So over the last 3 presentations, we've explored the deep connection between mood and brain health. And we learned how to recognize, again, the difference between normal memory changes and signs that something needs to be evaluated, because there's other kinds of memory issues that could actually be more clinical that we need to get checked out by like a medical team. And we've also looked at ways and covered practical solutions to help boost memory and mood in our own lives. And so today, in this part 4, we're going to be looking at ways to support our loved ones. And we're going to be really turning our attention outward. And yes, if we're starting to go through some of these changes ourselves, cognitively, we can also apply these things to our own lives. But for today's presentation, again, we're going to just kind of be looking at how do we support, kind of the people around us, and how to, again, make some of these things normal conversations. How do we kind of take the stigma off of, okay, something, isn't exactly right. This might be a little more advanced than just someone being a little forgetful here and there. Like, we're starting clinically to see there's signs and symptoms that something else might need to get checked out. And so, it's like, how do we normalize those conversations? How do we be supportive? How do we not be judgmental, etc.? And so those are all the different kinds of things, that we're going to be talking about today. And again, this presentation is really to offer, meaningful, dignified support through those kind of experiences as someone does experience memory and mood changes. So we're going to look at ways, how do you show up with patience? Patience for your own self as you're going through it, supporting patience for the people around you. And, and again, sometimes it can feel a little chaotic. Also, how do we show up with empathy, and how do we have compassion, honestly, and keep compassion at the heart of every interaction that we have. So if you have a spouse, a parent, sibling, child, friend, etc., someone who is going through this and actively experiencing this, today's presentation is especially for you. So thank you for joining me. And again, I'm Jen with Aging Advantage. In Aging Advantage, we are a non-for-profit organization here in the St. Louis, Missouri area. We support St. Louis and the surrounding area. And we are able to do that through grants and donations as well. But we're able to provide educational opportunities like this today to be able to really help with the effects of different things, health topics, but also to be able to support, with the effects of like post-pandemic situations as well, like housing, food insecurities, isolation issues, and really being able, again, to promote like better self-resilience and reliance on ourselves, so that we are able to be more independent and be more confident in that independence and have our own health, be a priority. Physical, mental, spiritual, all of the parts, emotional, etc. And those are really just, key key education topics that we love to be able to share. And we do partner with other organizations as well to be able to provide these educational opportunities too. So if you have anyone in particular from an organization standpoint that you would love to learn more about, please let us know and we will add them to the series. So anyway, for today's presentation, sit back, relax, grab your drink, and get cozy. And let's get started on part 4 and our final presentation that we will have attached to this memory, mood, and meaning series. Again, this is our official part 4 of our 4-part series. And we're going to look at ways we support our loved ones. So supporting someone we care about through memory or mood changes can really bring up a lot of emotions. And I think this is, again, the perfect opening thing to discuss because it brings up a lot of worry and sadness, even frustration at times. And that's completely human. So today's goal is to really give you some grounded, compassionate tools to help you navigate this journey alongside the people that you love. And again, like we talked about in the part 3 series, is that, a lot of times we have a lot more patience, sometimes not, with other people than we do for ourselves. Sometimes also though, too, it is, it can be highly frustrating as we're all trying to, as we're all trying to support someone that is going through these mood and memory changes. There can unfortunately sometimes be a lot of like reactive things that we all might need to jump in and handle. Everything from, somebody getting lost, trying to get home when they've always known how to get home, or getting lost, even going to the mailbox, and then they're, wandering around outside and we don't know where, or they forget to turn off the stove and they burn something, or forget to turn off the water. So, and those are just little quick examples, but it's very easy to get frustrated sometimes with different things, again, that kind of like come about that we have to sometimes, sometimes we can plan for some of these things, but sometimes we can't, we're literally just last minute springing into action to try and get, a situation stabilized, right? Or trying to get a situation cleaned up and or supported for that matter. And so, it's challenging. And so, I think again, like how we talked about, the first step is that awareness, right? But then the second step is going to be acceptance, like just accepting, like, okay, this is, again, you may not like it. The other person obviously also who's going through it also doesn't like it. I'm sure. But again, like accepting, like, okay, like this is where we're at, and this is what we're working with. And, how do we just make the most of what we can control in this whole scenario? And how do we proactively and preventatively put things in place so that, we're not constantly, frustrated and triggered sometimes. And so, that's where, today's goal is going to give you some grounded, compassionate tools to help you navigate this journey alongside the people that you love. So this one is going to be, oh, hold on, let me go back here. Okay. One of the things I want to, sorry, that I forgot to talk about here is that, I want to help you guys also, explore like how to offer like meaningful, dignified support to those people who are experiencing memory and mood changes, like, we discussed. But I want to, just pause for a moment here and really just talk about the word dignified, right? Because when someone we love is like struggling with memory or mood, it can be really tempting to take over and just speak for them or treat them differently than before. And, that is great, but one of the most caring things sometimes we can do is to continue to see them fully and fully as a person. So, not as a diagnosis or a set of symptoms, but really as the whole person that they've always been. And this again can be challenging. um, for all parties, for the person going through the memory issues and for the people also that are trying to support someone. But sometimes, even speaking to this, and the whole dignified thing is, like let them try to navigate something themselves, safely, obviously, or let them try to answer, themselves the question or something like that. And then if you need to step in and you need to help, clean it up, or maybe they got about 60% of it right, and then you just need to do the other 40%. Just having patience to let them get through that 60% first. And then, add a little, your bonus flair of helping, with the other percent, to get the full picture done, I think is, a great way sometimes kind of to look at that. So, responding with patience, let's talk about one of the most important tools that we have, and it's free, it doesn't cost anything, and that is patience. But this is also one of the easiest tools that we also have to not do so well with sometimes from a delivery standpoint. Patience and empathy are often at the heart of compassionate caregiving, and really like just taking the time to truly listen and just validate the feelings of your loved one is absolutely important. Avoid again rushing or showing frustration if possible, and try to have, a calm, unhurried presence. And by doing that, it can really help them to feel safe and respected and also understood. And again, I know this is easier said than done. But, if you repeated the same answer to the same question multiple times in one conversation, or watch someone struggle to find a word, you know absolutely how tempting it can be to feel impatient or even just finish their sentences for them or tell them, for that matter, already heard that, 15 times. We've already been through this. I already know the story, and finish ending the story, for them. But try to remember for the person experiencing these changes, it can really feel frightening and frustrating too. So, a calm, unhurried presence does something powerful. It tells them without words that they are safe with you. And, that message matters more than getting every detail of the conversation, perfect. And a thing I think to remember with this as well is that, your presence as, somebody supporting someone like this, your presence isn't merely just, your physical presence, right? Um, Again, your, just or how you're going to verbally jump in, step in, respond. So, um, I think again, just being cognizant of your nonverbal expressions, like are your arms crossed? Are you, tapping your fingers like, come on, come on, come on, let's go, let's go? Are you eyeball rolling? Are you not paying attention? Are you looking around? What, in the middle of them trying to talk and say the same thing 15 times? Did you get up and now you're, walking around the room and you're doing something else? All of these different things. Maybe, well, nowadays with technology, did you get out your phone and now you're playing on your phone, and not paying attention? So, pay attention to how, again, not only your verbal patience is showing up, but how your nonverbal patience is also showing up. And, with that as well, kind of the 3.0, that's the 2.0, the nonverbals, but the 3.0 kind of that also that I want you to be cognizant too is, pay attention to how you are feeling inside your body. So again, we can feel highly frustrated, highly annoyed, sometimes, even like angry, or, sometimes like saddened, or, again, just annoyed and like rushed and things like that, right? And just disconnected sometimes too, from the person. But, again, oh, and this is a good one too. Like you can also have a lot of anxiety yourself, or it can be causing kind of some depression for you, like watching the person struggle and go through, the searching for words and trying to get the task right and all the things. But I think something to be cognizant of, again, is just paying attention to how you feel inside your body, because, not only are we like talking, seeing, hearing, whatever, feeling, touching, whatever, we have all those senses, right? Human beings, but we also are vibrational kind of human beings as well. And so, pay attention to what you're feeling, and then also what kind of like vibrational feelings are you putting out that the other person also might be sensing, right? So, and I know that sounds a little like woo woo or out there. However, example of this is as soon as I say this, you'll be like, oh, yep, now I get it. Example of this is, like with animals, right? Animals can't talk to us directly, but they can sense you, right? It's like that whole thing that for like a horse can literally feel you. I forgot what it is, so do not quote me on this, but it is something crazy like 10 feet away or something like that, 12 feet away. Like they can feel you, and your energy. And, if you're calm, if you're anxious, if you're, nervous, if you're, whatever you are, if you're fearful. And same thing, like, for example, like with dogs, right? Or other animals. And so that's why, it's like sometimes like a dog will, raise all its fur up on its back, show its teeth, and it'll growl and it might even bite you. But sometimes, people, and you'll know that example, it's like because dogs can sense, and sometimes people can even like animals can even like smell, the different pheromones and stuff like that that you put off. But again, just know that and remember that you bring all of that, vibrationally, etc., if you will, to the table also when you are interacting with another human being. Sometimes you're just in a space with somebody and like you can't explain it. It just feels off. And, the other person or you hasn't ever even said one word yet, but you already just know like, this isn't going to go well. Um, Same kind of thing. So, I just want to come back to this for a minute and again, just, encourage you, not only is this patience, verbally what you're saying, but 2.0, pay attention to your nonverbals. And 3.0, pay attention to, are you feeling anxiety? Are you feeling fearful? Are you feeling stressed? And if so, like pause, take a breath, and figure out for yourself, what you need to do in that moment to recenter yourself, to refocus yourself, and to get yourself calm and try to be as peaceful as possible and supportive and loving as possible so that that's what you're putting out, toward the other person. So, encouraging evaluation and support. Now, let's talk about a topic that can feel especially delicate. Um, how are you going to engage, in these kind of conversations? And how are you also going to encourage a loved one to seek an evaluation? So, Here's some kind of different tools that you can try. So, gentle suggestion. So, gently encourage a loved one to seek professional assessment, maybe framing it as a caring, and again, like we talked about before, proactive step to well being. And, you want to do this, emphasis on the word here, proactive, everyone. You want to do this when you start thinking that something might be a little off because you don't want to wait until there's like a crisis situation that happens. And you want to, also not pose the suggestion, as in like acquisition or something like that. You want to be supportive with it. So, for example, like what words might you say, or how could you say this in a in a good way versus maybe a not so smooth way. So, for example, rather than saying, "I think something's wrong with you," which would be not the smooth way to deliver the gentle suggestion, you might instead, a better way to deliver it might be instead saying something like, "I love you and I want to make sure we're both taking care of ourselves. Would you be willing to get a checkup together?" And so you can frame it a lot different. And so that second one feels a lot less finger pointy. And again, a lot less something is wrong with you, although, again, there could totally be something starting to go wrong, and progress, but it makes them feel a lot more supported the second way. Navigating resources. So, offer to help research and connect with memory clinics, counselors, or community support services so they don't face it alone. You don't have to have all the answers. You just have to be willing to walk alongside them as they figure it out. And again, their memory, their cognition, their follow through on doing tasks, etc., might not be the best, depending on what stage you can catch this in. So, unfortunately or fortunately, however you want to look at it, you might need to be kind of the captain of the ship, as they call it. So you might need to be the one to drive the research and have the conversations and set up the appointments and get the person to the appointments and things like that. So you might be having to do a lot of the quarterbacking, if you will, of trying to coordinate all the different kinds of care. But just know, again, there's help and support for you as well with great family caregiver programs. That's where the social workers can be absolutely amazing. Case managers, care managers, all the things that some of these doctors' offices actually have attached to them internally. So, or, the hospitals or whatever. So you can absolutely always, 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 always ask, do you have any social workers that we can connect with that, might have some really great resources to support? And usually someone medical usually always does, which is a beautiful thing. So the benefits of early hope. So remember, again, as we learned in part 2, that early evaluation opens up more treatment options. So it supports better quality of life and really empowers informed decisions for the future. And, this is worth gently reminding your loved one if they're going to be hesitant about it. And again, I'm going to go back to the word, um, you know, um, of again, like early evaluations opens more treatment options, right? But again, informed is the word that we are going to be focusing on here because if you can, get your loved one who's struggling with some of this stuff involved while they still have, again, they may only be, 20, 30%, into the potential, 100% full expression that can occur. But it is way better to have them be involved for planning, their care, how they want things to go. Do they want to be able to stay at home? Do they want to be in a memory care place while they are still cognizant and still able to be, part of the care plan team? You can take them to some of the different memory care places and you can all check them out together and see what that would look like. You can have conversations. We might have to move you from your home here and we might have to move you to, Arizona to live closer to one of the others, one of the other, children that they have or something, or one of your siblings that has a better memory care um, location there. And so having the person, though, be able to cognizantly be a part of those conversations and a part of those choices is a beautiful thing. And so that's where I always, always, always encourage you, if nothing else, and they won't, respond to anything else, use that as a tool, a motivating tool to have them get checked out again so that they can be a part of the informed decisions that are going to happen, for their future. If a loved one that you are supporting resist the idea of doing an evaluation, try not to push too hard in one conversation. Sometimes it can take, a few gentle conversations over time before someone's, feels ready. So be patient, keep the doors open, but keep bringing it up. Don't just bring it up once or twice and then, let it, go dormant. Absolutely, keep staying on it until you get the evaluation done if they need. This next session addresses something incredibly important, and this is the stigma. So stigma around memory and mood changes can absolutely prevent people from seeking help. This is one of the biggest barriers that people face. It's not a lack of resources because there are a lot of resources out there, but I think for both sides, the fear and shame of keeping people from reaching out for support really in the first place. And so that's why they don't. So having open, supportive communication, though, helps loved ones to feel safe. And, not every person deserves, I get that, to, to, okay, and I'm gonna word this differently here. So, again, depending on what stage you catch this in, right? So if someone is already at, 80, 90% of the way, to like, full blown symptoms, et cetera, whatever, not everyone will be able to be part of, the decisions that's going to happen with them and all the things. But even at that, no matter where they are, on the spectrum when they get, diagnosed, just remember though that like every person deserves to be met with dignity and respect and compassion, not judgment, fear, anxiety, resentfulness, etc. That can absolutely happen. And, I want to speak directly to anyone watching who might be worried about their own memory or mood also, or supporting someone who is, there's no shame in aging. There's no shame also in needing support at some point. And these experiences, again, are part of being a human being. Congratulations, you're a human, yay. And this is how it's going to go. If we have the opportunity to live long enough, again, our bodies are going to change, our minds are going to change. But again, they deserve to be met with the same compassion that we'd offer anyone else with any other health condition. Nothing more, nothing less. I think a lot of times, in doctor land, we have these conversations a lot with patients, especially patients, again, like a patient that has, something emotionally happening, mentally happening, psychiatry kind of related things that are happening. Also, sometimes, people who have cancer, etc., and are still in the, early stages, and, they still like look fine. And I think that's where it gets tricky because from a how do we treat one another, it sometimes it's easier just as a society, we're kind of just like trained this way to have compassion for someone that, has a cast on and is on crutches. Or you can see that they're, an amputee or, whatever it is. Like pick a body part head to toe. But when you can physically see that, somebody has something, that they're struggling with, I think it's easier to have compassion for those people than it is to have compassion for people sometimes to where you can't physically see on their body, like what is going on with them. It's an internal thing. And so, again, just trying to remember, okay, like this person is also a human being, and I need to still have the same compassion for them as I would for somebody who has a physical, diagnosis of something going on that I could see. And if you're a caregiver, it's one of the most powerful roles you can play is simply that's just being someone your loved one can be honest with, without fear and without judgment is also huge because, again, they're going through a plethora of emotions and changes themselves, and it can be fearful and scary to them as well. So, again, just being that soft place that people can communicate with you and, feel accepted and safe is one of the best ways that you can show up. So now let's look at this section with something practical. So where can you actually turn for help? We're going to look at memory clinics first. So contact your local memory clinics, or also this is a great place too to start that I don't think people realize, but like neurology center for early evaluations, diagnoses, and again, getting like a personalized care plan. So these specialized centers can offer much more through assessment than just, a general checkup with your regular primary care doctor alone. Like that could be a great place to start, but, and that could be a great place to start again. Because they can do other blood work and do other kinds of tests again to make sure and rule out, is it, that it isn't any of these other things that, they think it is actually, a memory issue that, we're actually starting to deal with. Caregiver support groups are key. These things are literally a lifesaver for the people who are providing care. You've heard me say this a million times. I'm going to say it a million times more, but the saying of success leaves clues. And so that's where, I think the power of these caregiver support groups really come in. Because when you join a caregiver and senior support groups, you can have shared experiences. You can give each other emotional support, but you can also share like practical guidance and tips and tricks with each other. Usually, as well, they are also going to be staffed or connected with different trained facilitators that can do education on different things and topics, etc., and provide support that way too, which is absolutely beautiful. So if you are a caregiver, again, please hear this. You don't have to carry this alone. So connecting with others who understand what you're going through can make an enormous difference for you and the person you're caring for. Community programs. So explore community programs that promote social engagement, brain activities, and meaningful connection for older adults. Many of these are way more accessible and affordable than people actually expect. So I'd encourage you, again, if any of this resonates with you today, to write down one resource you'd like to look into this week, whether it's, a memory clinic, maybe connecting with a support group, or, even a local community program. But taking that, first small step can really open up a lot of support for all of us. So, and again, just, super, super important. So, as we close out our presentation today, um, and our 4-part series, I just want to say thank you. We appreciate your time and your attention throughout the series, and we invite your questions and open discussion as well, and your insights and also experiences. And those absolutely matter to us because, again, success leaves clues. And so the more, you all can support each other as well, it just makes the whole community surrounding this topic just a lot smoother, more beautiful, and just easier for everyone to navigate. And again, it helps to normalize some of these conversations and challenges that we can, be experiencing. Absolutely. So let's take a moment to look back at everything that we've learned and covered together. So in part 1, we explored the deep connection between emotional health and brain health. And then in part 2, we learned how to normalize memory changes versus signs that need an actual evaluation. In part 3, we discovered practical everyday ways to boost mood and memory. And then today, in part 4, in our final part, we talked about how to help support people we love with patience and compassion, and again, the dignity word. And, again, sometimes, it's easier said than done, right? But there's one thread that commonly is running through all 4 of these presentations, and it is mood and memory are deeply connected. And caring for one is really caring for the other. And whether you're taking small steps for your own well-being or you're supporting someone you love, again, just knowing that implementing some of these small, consistent efforts, again, into your daily life and into your daily schedule can really make a meaningful difference over time. So I would absolutely encourage you to continue looking at the things that might interest you, that you might want to add, and get them in the calendar, get them in the schedule, and start doing them every day or every week if you can. So again, thank you for spending time with us throughout the series. And if you have found this content helpful and valuable, please follow Aging Advantage on Facebook and subscribe to our YouTube channel, where you will find this full series along with our other presentations as well on our other topics. So take care of yourself and take care of each other. And thank you for spending time with me again today and for being a part of our Aging Advantage community.